Good afternoon. This is Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We have a lot of topics to cover today, including disappearing federal websites. But before we do that, down below is the YouTube description box, and in there you'll find a link to the Healthcare Advocacy newsletter that is the text for this video. It has all of the hyperlinks to medical research reports, news stories, background material, and a whole host of other references all the way down at the bottom of every newsletter. Somebody pointed out to me that one of the hyperlinks in our resources section has actually disappeared. The federal government has taken it down, and I'll explain that. Federal websites are rapidly vanishing, and the one that disappeared from my reference section was the CISA misinformation page. Isn't that a surprise? CISA is a government agency that was set up to help monitor cybersecurity for the government and actually to help protect the public. Anyway, their information page on disinformation is gone. In that one line down at the bottom, there is a second link in that cybersecurity section on protecting yourself. That information is there. I also want to say that there's a lot of concern that vaccine information is going to disappear from Health and Human Services or Center for Disease Control websites. Because of that, I've put a permanent link in the resource section to the recommendations for childhood and adolescent vaccinations. So make use of it if it applies to you. Subjugation of women in Missouri. This past November, Missouri voters narrowly approved a ballot measure to add the right to an abortion to their state constitution. About a month later, a judge ruled that Missouri's near-total abortion ban, which went into effect in 2022 after the U.S. Supreme Court overturned Roe v. Wade, was now unenforceable under the new constitutional amendment. This sounds like great news, right? But wait. Legislation was just introduced this past week in Missouri that would create a list of at-risk pregnant women in the state in order to reduce the number of preventable abortions. Not clear how they would do that. House Bill 807, nicknamed Save Mo Babies, M-O is the two-letter symbol for Missouri, I'm sure they think they're being funny, was proposed by Republican State Representative Phil Amato. The bill summary states that if passed, Missouri would create a registry of every expecting mother in the state who is at risk for seeking an abortion. I don't know how you figure that out. Starting July 1st, 2026. The list would be created through the Maternal and Child Services Division of the Department of Social Services. The measure did not specify how at risk would be determined. The bill would mandate the promotion of the safe and healthy birth of children in the state through the utilization of existing resources, coordinate community resources, and provide assistance or services to expecting mothers identified to be at risk for seeking abortion services. And it would prevent abortions through the adoption of children by fit and proper adoptive parents. I just want to scream. Anyway, lawmakers in the state are also pushing for stricter abortion laws. I don't know how they're going to do that. With a bill introduced last month that would prohibit abortions if a fetal heartbeat is detected except in cases of medical emergency. By the way, we've already seen in Texas that kills women. Despite the fact that their constitution now enshrines the right to an abortion, these guys are living in a dream world, and you should vote them out. Bird flu and the FDA. The U.S. Department of Agriculture said this past week that last weekend it accidentally, which I personally believe, in my humble opinion, is bullshit, fired several agency employees who were working on the federal government's response to H5N1, the avian flu outbreak. They are aiming at employees with probationary status. Now, that typically applies to someone who has been with the federal government for less than 2 years, but before full civil service protections kick in. However, bad news, it can also apply to a very long-term civil servant Who has moved to a different agency or was promoted? This thing is a disaster. Anyway, the Trump administration cited performance issues in letters to the fired employees, explaining that they were let go, why they were let go, though some of those same employees have received strong performance reviews from their superiors. The agency says it's now trying to quickly reverse things. I got news for you. I don't believe that either. There's a link to the NBC story. The latest episode comes as the virus has decimated poultry flocks and sent egg prices soaring. The CDC confirmed 68 cases of bird flu among humans so far. There has been at least one human death. It is thought that the number of human cases is actually larger, as a number of large animal veterinarians who treat cattle may also have been infected but not reported it. Prices of eggs due to the bird flu decimating flocks is huge. In my neighborhood, about last November or so, it was $1.80, $1.50, $1.80 for a dozen. When I wrote this article, it was $4.99 over at Trader Joe's. I was in the Winco store just the other day. I think I saw $7. The error is that the latest in the Trump administration's attempts to rapidly shrink the size of the government by conducting mass firings of federal workers. This is an effort being carried out by tech billionaire Elon Musk and the U.S. Department of Government Efficiency, which is heavily staffed by people who have no experience in government and are generally computer hackers, not actually trained software developers. On Friday, the administration tried to notify some nuclear safety employees who were fired last week that they are now due to be reinstated, but struggled to find them because they don't have their contact information. For me, this one's also important because here in the Tri-City areas in Washington, that's where the Hanford reactor is located, and that is a hugely polluted nuclear site. Also, in my opinion, I think this whole thing is nonsense about them not being able to find people's information, because if you worked anywhere, the U.S. government or a nonprofit or a for-profit company, HR knows how to find you. So it's nonsense. Let's talk about measles outbreak and a warning. At least 58 new cases of measles have been reported across Northwest Texas in recent weeks. I actually think it's up to about 100 now. This was reported last Tuesday in a highly contagious outbreak that is linked to a lack of vaccination. The bulk of the new cases in rural Northwest Texas are in Gaines County with 45 documented cases, according to the Texas State Health Department. In the last 3 weeks, 9 more cases came in from Terry County, 2 from Yoakum, and 1 each from Lubbock and Lynn counties. Now, at least 4 patients were vaccinated, but the rest are unvaccinated or their vaccination status is unknown. Most of the infections are in school-aged children, and 13 have been hospitalized. More cases are expected, you bet, because people who get measles generally have very few symptoms in the first few days, and you're contagious. And if you haven't been vaccinated, you're at risk. I got to tell you, the risk is significant. You can wind up with hospitalization and death, and there is a possibility, it is not remote, but it is a real possibility for getting an encephalitis years later after you've had the measles. It is important to get vaccinated because it prevents the disease. Anyway, it's highly contagious. It can lead to very serious complications. Symptoms usually begin 7 to 14 days after infection. I'm sorry, it wasn't 4. So this gives you a long time to have this stuff floating in your bloodstream. It can be dangerous, especially for babies and young children. Now, what I've done is in the newsletter, I've actually copied the CDC guidance on it. I have replicated it in the newsletter. I'll go through it briefly with you. So first, prevent measles, get vaccinated. If you think you've been exposed, talk to your health professional about what to do if you've been exposed, and talk to them if you haven't had a vaccination about getting the MMR, measles, mumps, and rubella vaccine. Symptoms, as I said, 1 to 2 weeks after contact with the virus, measles begins with a high fever. Remember, this is more than a week after you've been exposed. A high fever, cough, runny nose, red watery eyes, that's conjunctivitis. 2 to 3 days after those symptoms begin, you get tiny white spots, often on the inside of the mouth. Those are called Koplik spots. About 3 to 5 days after symptoms, you get a rash. It usually starts as flat red spots on the face or at the hairline. Then it spreads downward to the neck, the trunk, arms, legs, and feet. Small raised bumps can appear on top of the red flat spots. If you've ever had urticaria, it kind of looks like that. The spots may be joined together as they spread from head to the rest of the body. When the rash appears, your fever can go as high as 104 degrees or higher. You got to call a doctor because it is not safe to have that high a fever. Some of the common complications: ear infections in 10% of the children with measles. Diarrhea, slightly less than 10% of the people get diarrhea. Who's at risk? Measles can be serious for all ages. However, there are several groups more likely to suffer complications: children younger than 5 and adults 20 and older. Pregnant women and people with weakened immune systems, such as from leukemia or cancer treatment or HIV. Severe complications in children and adults, and they can be severe for everybody. Some people may suffer from severe complications like pneumonia or encephalitis, which is a swelling of the brain. They may also need to be hospitalized, and they could die. Hospitalizations in the unvaccinated population who get measles, about 20% have to be hospitalized. Pneumonia, as many as 5% of the children with measles get pneumonia. The most common cause of death from measles is pneumonia for young children. Encephalitis, about 1 out of 1,000 children who get measles will get encephalitis, the brain swelling. This can lead to convulsions and can leave the child either deaf or with an intellectual disability. About 1 to 3 of every 1,000 children who become infected with measles die from respiratory or neurologic complications. Is it worth any of this? Complications during pregnancy. If you are pregnant and have not had the MMR vaccine, measles may cause birth prematurely, or you may have a low birth weight baby. Long-term complications, and this one I didn't know, and it is super scary. It's called subacute sclerosing panencephalitis, or SSPE for short. It is rare, but it is a fatal disease of the central nervous system. It results from a measles virus infection that was acquired earlier in life. It generally develops 7 to 10 years after a person has measles, even though the person seems to have fully recovered from the illness. Since measles was temporarily eliminated in the United States in 2000, SSPE is rarely reported in the U.S. Among the people who contracted measles during the resurgence in the United States from 1989 to 1991, 7 to 11 out of every 100,000 were estimated to be at risk for developing SSPE. You get it, you die. The risk of SSPE may be higher for a person who gets measles before they're 2 years old. You got it? It is so dangerous. Just get vaccinated. Look, here's another thing we can do. Let's take action against Trump, because he's taking action against all of us. He's got an agenda, and we got to fight back against it. Public protests are important. According to Dr. Erica Chenoweth at Harvard, if 3.5% of us are out in the street protesting and boycotting, we can reclaim our democracy and stop this madness. In the newsletter, I have a link to her research report published at Harvard. 5051, spelled out, is a grassroots organization and lists a lot of upcoming protests nationwide. Indivisible is another good place to align with people opposing Trump and MAGA, and you should check Mobilize, or mobilize.us. I will put links to all of those places, all of those sites to find protests in the YouTube description box. One more thing, February 28th, National Day of Protest, economic blackout. Do your best to buy nothing. If you have to buy something like an essential item, get it from a local store, not a chain store, if it's at all possible. Look, whatever action you take is great, but it's important to take action. Let me give you an action that you can do right away. 42 million Americans need food assistance every month, and there are another 5 million seniors too ashamed to ask for help who are hungry. Republicans in Congress and Trump want to cut nutrition assistance to help fund massive tax cuts for the wealthy and businesses, and they want to pay for it on the backs of the poor. This comes from Rogan's List. I have a link to a website that will show you how many people in your neighborhood, in your congressional district, are on food stamps, SNAP, and how many get Medicaid. There is a calling tool. It's all in the newsletter. Instead of replicating it in the YouTube box, go to the newsletter. There's a call script that you can get to by link. There's an email service you can get to, which will send emails to Congress. And let me point out, if it's at all possible, contact your member of Congress before Tuesday, the 5th, before February 25th, and tell them no budget resolution. Forget it. Nothing that has to do with cutting Medicaid and food stamps, because that's what's in the budget resolution right now, if at all possible. That's what I've got for you today. Down below, you can like, share, and subscribe, and we'll talk to you later. Have a good day.